Okay.
In three, two. Hey, Gabe. So talk to us. Tell me one or a couple ground marketing tactics or strategies that you know can definitely help other practice owners out if we were to implement it today.
Sure, Michael. So you approached me about this and asked about how to market yourself to specialty providers, specifically, I think like speech therapist, OT, occupational therapy, food therapist, even in our area. And as a
Mhm.
pediatric dentist, I got to represent the tooth. Okay. So I got to represent the tooth. I'm wearing the tooth shirt today because obviously we got to defend the tooth.
I like that.
Um, I'll let you know, it kind of is something that kind of happened upon my accident, and it had to do with my own son. So when my son was 18 months old, went to his pediatrician, and we had our follow-up appointment that you have around a year to 2 years. And the pediatrician's like, yeah, he's just not making his goals. He's falling behind. He's not where he needs to be in speech. We would get him a referral, go see a speech therapist, go see a occupational therapist, go see an early intervention specialist, all these specialists. And I'm like, as a father, I was like, oh my God, I failed my child. They're not even three, and I'm having to go see all these therapists. And that's how I thought it was going to be. And I
Mhm.
met these therapists and started talking with them, and completely changed my view on how, as a pediatric dentist, I can work with therapists because they see kids.
Yeah.
They see kids with special healthcare needs. They see kids with social needs. They see kids with speech delays. They see kids with occupational issues. And around the mouth, there's a lot of motor, oral, sensory type of things that some children need help with. And when you find the right therapist, it can really help your child grow. And so we got hooked up with some great therapists. One who's actually a personal friend of mine now that I still work with a lot in my area and hang out with even outside of work because he's just a great guy. We both have kids the same age. He's fantastic. So for me, it was watching the speech therapist, watching the occupational therapist, and the early intervention specialist work with my son at home. That
Mhm.
really started getting me thinking, okay, this is somewhere where I can go ahead and market myself because we're all seeing pediatric cohorts, right? We all are working with children. This could be an avenue of exploring that. And it wasn't until I went to a course up in Greenville, South Carolina, that's was organized by Dr. Ann Bynum.
Mhm.
And there's a course called Plot the Tot, and has to do a lot with frenectomies and tongue ties and stuff. And I kind of knew a lot about tongue ties and restrictive oral tissues before I went there. But when I went to that course, they really made a big push on having this team approach of speech therapists, occupational therapists, sleep, doctors, and other things to help treat children with these tethered tissues. And it started making me think, I've been looking at the avenues of marketing way too narrowly. I need to open my
Yeah.
mind up here. And so when I came back from that course, I set up time to talk to my son's speech therapist, and we sat down and we just had lunch together. And I was like, hey, let me take you to lunch. I want to meet you. I want to get to know you a little better, because I'm a pediatric dentist in your area, and occasionally kids need procedures done. So there was an ulterior motive. I just
Mhm.
sat down with him and met him and got to talk with him. Really awesome guy whose name is Guy. And so we sat down, we had lunch, we started talking about, our values and our goals, and we kind of just hit it off. And so I was like, okay, that was really super easy. Like that wasn't so bad. I can
Yeah.
totally do this. So then I reached out to his occupational therapist, and she was like, oh, well, I'm part of a big, massive group in your area, and let me go ahead and get some of your business cards, and I'll bring them to the center, and I'll let parents have them and things like that. Because many of these parents that bring their children there have children that are either have sensory processing disorders, a very common diagnosis for children going to occupational therapy, can be low motor tone, low motor core issues, other things of that nature. And so
Mhm.
they're looking for pediatric dentists because many times their generalists are just not comfortable seeing those patients with sensory processing disorder, the bright lights of a dental office. The pediatric dental office is kid
Yeah.
oriented, can be a really great place for them to feel comfortable. And so I started getting a few patients just like here and there, like, kind of hit and miss. And I finally spoke to a mom afterwards, and I was like, hey, you brought us your child, they needed treatment done. Um, we're working with your child. We do a lot of things called happy visits in our office where we get kids comfortable with coming. So they don't do any treatment. They just come in the office. They tour
Hmm.
the office. They get to view the office, and they get to kind of see it and meet me, maybe pick out a prize or something like that. And it gets them comfortable to come into the office. And think a lot of pediatric dentists do that. And when you have a small private office, you can do that. When you have a larger group, sometimes you don't always have the ability to do that. At least I found that when I worked for other people, I didn't have the ability to do that as much. And so I said, hey, Mrs. Smith, and it's not her name, they changed it, but Ms. Smith, you enjoyed your experience with your son, Johnny. Is there anything that I can do to help you or help other friends within your community who are being seen by the same occupational therapist to go ahead and help them? Because she mentioned, you guys are so special and unique with with my child. I want to see about having my friends come here. And I was like, let me tell you what, I'm going to set you up. Okay. And I gave her these brochures about our practice. I had cards made up that were little 4x6 cards, and I created QR codes on the back of them with a printer, and the parent gets the card and it's just small enough to actually fit in their hand. And if they want to make an appointment, scan it with their smartphone. They can make an appointment online with us, or they can learn about the practice, and it's all right there. And I gave her a bunch of those attached with a bunch of lollipops. Okay. And I know we'll get into that later, but I gave that to her and she used them all up. And she came back like, I need more. And I was like, okay. So we started like getting more and more. And so I started to go ahead and reach out. And then one time I got this patient in my schedule. And I tried to check my schedule a few days in advance. And I was like, okay, who is this place? I don't know who this person is. Like, why are they referring to me? I don't know who they are. And it turns out it was a speech therapist who had a friend, another speech therapy group that I worked with in the past and work with still. And she moved to another practice, another group. And she's like, I remember your name and I wanted to refer a patient to you. And I'm like, okay. And so I started looking at this group, and I just went and met them last Friday and kind of, introduced myself to them and met them at the office and say, hey, look, I'm interested in getting to know you guys, all of your therapists here, because they have about, I think it's 10 different therapists within their groups. They're a really big group in the area. And I said, hey, I'm a pediatric dentist and I provide, services of XYZ, whatever those services are. And they said, oh, well, we really need Y, which happened to be frenectomies. And they're really looking for somebody to do them because, it's a service that sometimes if there is a restrictive, and I don't want to get too much in the science of everything because that gets bogged down, but if there is this issue with that, many times it requires a provider. The two options for doing that are ENTs in our area and or pediatric dentists or general dentists, people who are comfortable doing it. And in our area alone, we don't see a lot of great results from ENTs, and parents have a lot of issues even after the procedure is done. And so we kind of have a different approach to it. And so because of that, the speech therapist knows about that, and they can say, hey, look, there's a pediatric dentist who's going to work with us. And we communicate very heavily back and forth with our groups about that. But it's about reaching out and getting to just know somebody and say, hey, look, can we sit down? Can we have time to talk? Because some people, if you just like drop off cookies, drop off a card, they may be like, okay, that was nice. This is great. But when they start to actually put a face to your name and they hear back from parents who are like, oh my God, I had a great experience. It was fantastic. And we really encourage our parents to post reviews that they had a great experience. We ask them, hey, if you had a great review, please go ahead and talk about it. And they do. And other parents start reading about that. And then there's a couple of Facebook groups that I've joined recently about, providers and parents and therapists who treat tethered oral tissues. So I joined that group, and there's some interesting rules in that Facebook group. You can't promote yourself directly, but you can tell people where you are and kind of just say, I'm here and you can look me up. And that's kind of been nice because a lot of parents, for us, that's been an avenue of connection most recently. And then to kind of summarize everything, sometimes it requires going back multiple times. Okay. Because with this initial group that I was getting started with, took me reaching out to Guy several times to make sure we could coordinate our schedules because he's busy, I'm busy. It took me about 3 or 4 times to reach out to Abby at this new group, Palmetto Spots, to get them to say, hey, look, can I stop by the office? Can I bring information? And it was after treating one of their patients and they got to see it, kind of like their sample. And they were like, oh, well, this guy really knows what he's doing, or gal knows what he's doing. And it took about, I'd say probably 3 or 4 like soft touches before we actually got to the point where we're starting to see more and more consistent referrals from them. So following up with them is important because I'm also next to a breastfeeding center in my office.
Oh, wow.
And I've been on their case for 2 years since I opened my doors about, hey, look, I have a laser. I can help you guys. You don't have to send all your patients like 35, 40 minutes away or to the ENT, which parents have better experience with. I'm right here. And it took me like 2 years of constantly going over there, like every 3 months, like, hey, I'm here. Can I meet with the doctors? Or, hey, I was in the area. I decided to bring you guys some, snacks or things like that. Or, hey, can I talk to lactation consultants? And I actually ran into one in the parking lot when we were leaving work one day. And I was like, we were doing an event and I went from my office and I was like, hey, you guys are next door to me. What's it going to take for me to sit down with you guys and like talk about these things? And she's like, I'll talk to you. I'll come to your office and talk with you. But it took me 2 years to get there.
Man.
Of constantly going back and being like, okay, can I talk to you guys? And she came over to my office on her lunch break and I was on lunch and we both sat down together and we talked about, how we view treatment and stuff. And it took her saying, ever since we had that conversation, it's been pretty consistent with getting children referred to us pretty consistently, infants primarily for that procedure, which, from a marketing standpoint of view to ROI, can be very profitable. It's done in the right way. I'm not saying about ROI, but I mean, truly, we have to have a return on our investments.
Yeah. So, yeah. No, that's really
it's taken some time. And then some of those things, some other groups in the area, I'm still reaching out to, and I'll reach out to them. I reach out to them for Christmas time. I'll reach out again to them probably on Valentine's Day as well, just to kind of touch base and show my face again and be like, I'm still here. I didn't forget you. Hope you didn't forget me, and just continue to remind them of that.
That's good.
Kind of what my experience has been with specialty groups in the area, just consistently, and then putting your name and your face out there and letting them know that even if they don't want to refer a patient to you, they have questions, you can be a resource for them and say, hey, look, I'm here to help you. I understand if you never refer a patient to your office's protocols or otherwise, I'm still a resource for you as a specialist to specialist. I'm still a resource for you. I can help you if you need help or you have questions about something.
Yeah, I like that. On the office where you did 3 to 4 soft touches to follow up, what did you initially say? And then what were you saying for the follow-ups?
So for the initial one was introducing myself. Hey, I'm Dr. Gabe Ross. I'm from Oak Landing Pediatric Dentistry. I'm a specialist in the area. One of my specialties that I have within my practice is tethered oral tissues. I know that they can affect speech for speech therapists. When can we set up a time to kind of discuss how we can best help each other? Because I need a good speech therapist to refer my patients to. And so kind of doing that little, dangle of, hey, there's some, something in it for you too. There's reciprocity here. And I do like that because I do refer them to those offices. We have parents come in, especially from just moved to the area. We tell them, hey, I see some issues in your child here with their speech and things. And they're like, oh yeah, they've always had problems. We just kind of like work through it. And I'm like, well, can I get you in touch with a good speech therapist? Because I have one and they're great and they're a fantastic group and they're going to be awesome. And they're like, yeah, you know what? That would be great. We'd love that. And so it's kind of reciprocity back and forth with those things. So that was the first touch with them. The second touch was, hey, I noticed, we reached out to you guys and I think we saw one patient from you, but I just want to let you know if you guys have anything else or they need to stop by and bring some more things, or hey, you never got that lunch with me. Let's schedule that time. Let's do it together. Let's get together and get to meet each other a little bit better outside of the office, or just trying to push them to have. For me, it's FaceTime. Even with COVID, I think if we spend some time together, at least 5 or 10 minutes, I'm going to have a much better chance and success of you going, it's not just an office, it's a person. And I know that person. And I can say I've talked to that person and I kind of feel comfortable with that person. So that for me is kind of the thing right there, having physical face-to-face interaction or 6 feet or mask, however you want to do it. It's like trying to get that in-person contact versus like just sending it. Because if you just send gifts all the time, or you just like stop in when they're not there or they're busy, and I stopped in different times too. So I picked like lunch, I picked like later in the evening, I picked like mid-afternoon, I picked like early in the morning. Like I kind of like varied my times up a little bit to try and see, because they're busy too, right? And they have clients and they see patients. And then sometimes it took just waiting, like sitting in their waiting room and just like being able to wait and be like, okay, I know you're with a patient. I'm going to wait till you're done and then we'll chat and then I'll leave. Okay. But I'm going to
Yeah.
wait for you. I'm not going to be like, oh, I don't have time to wait for them. Because that kind of shows them you don't have time to actually like listen to them. You actually have just like other things to do.
Yeah, no, that's super. I think that's always like I noticed, and I think I talked about it in the course too, but like whenever you show up in person, like you get a lot more, I guess like
Yeah.
closing rate, like, you know what I mean? Or to call it that. But
You do because I mean, there's something about that person to person interaction. When you actually have that like connection with somebody, you both find out, hey, we both went to USC and we both love the Gamecocks. I mean, you could, say that, or hey, we're both big, Clemson fans, or some kind of way of connecting beyond just your specialty or your service that you have. It makes that connection memorable, even if it's just like, oh, we went to the same high school together, or your sibling goes to the same high school as me, or, something like that. Something silly like that. It's still enough to connect and make people remember you.
yeah, yeah, definitely, definitely. Awesome, Gabe. So I appreciate your time. And if anyone has further questions, you can definitely find them in the Dental Marketer Society Facebook group, or where can they reach out to you directly?
If they want to reach out direct to me, I'm perfectly fine with them texting me or emailing. I'm assuming this goes out to pediatric dentists or other dentists and the like. That's fine. My email address is Dr Gabe, DRGABE at oaklandingkids.com. You can also text me on my cell phone, 803-537-9136. Happy to always help a colleague out, or encourage them, or kind of just shoot the breeze, or talk about things they may be having questions about, things that work for me and things that don't work for me. So we can both learn together. Okay. Well, thank you for your
Awesome.
time, Michael. I appreciate it.
All right. Thank you for being with me on this Monday morning marketing episode.
All right. Thanks, man.